Good afternoon. My name is Marla McGinnis, and I will be your moderator today for today's post-cabinet question and answer session. As a reminder to anyone joining us online, this is not a COVID briefing. The Honourable Tim Houston, Premier of Nova Scotia, will now take questions from media, beginning with Mike Gorman with CBC. Go ahead, Mike.
Thank you. Premier, I'm wondering, in light of the minimum wage report that came out, how long will you take to determine whether you will follow their out-year recommendations to get $15? And what consultation is left to do, really, on that issue anyway?
Yeah, no, the answer is not long. I've kind of talked to Cabinet and Caucus just take about a week. Listen to Nova Scotians, talk to Nova Scotians about it. Of course, the first increase happens April 1st. That will happen up to $13.35. And then what I would say is, look, we have, and this is kind of the way I feel about issues like this. You ask Nova Scotians to do some work, to do an analysis, and come forward with some recommendations, and you put high quality people into those roles, and they go away and do the work. It's governments should always come down on the side of respecting their recommendations as opposed to undermining. So from what I can see, I have no interest in undermining the work of the committee. I thank the committee for their work on that. We'll take a short bit of time, listen to Nova Scotians from across the province on their thoughts, but my inclination is not to undermine that work. It's to accept that work. But we'll just take a week or so just to kind of make sure we're listening to Nova Scotians on that.
Mike, do you have a follow-up question?
Yeah, thank you. Premier, one of the concerns that I've heard throughout the years when this subject comes up is what increasing the minimum wage might do to businesses. But do you think we've moved beyond that, given that many businesses are struggling to attract workers, and the reality is that $15 is not what's considered a living wage, and the cost of living has gone up exponentially in the last couple of years?
Yeah, I think you're right. In the world changes, the circumstances always change, and the situation facing Nova Scotians today is different than the situation that was facing Nova Scotians 10 years ago, or 5 years ago, or even 3 years ago, or 2 years ago. So we always look at what's in front of us, and I think the committee has done the work. We'll reach out to members of the committee too, but they've done the work. They would have considered all of these factors, and my initial reaction is that they've done some good work on behalf of Nova Scotians, and now we'll just make sure we're listening to Nova Scotians about what impact it might have on them. But as you can tell, I'm coming down on the side of respecting the work that has been done by that committee as opposed to undermining it.
Next, we'll go to Alicia Drost with Global. Go ahead, Alicia.
Thank you. Premier, with further reductions being made at hospitals, just like in terms of surgeries and things like that, what's being done to ensure that things will be able to get back on track after this Omicron wave, given that we were already backed up even before COVID and then more backed up with surgeries due to cancellations and reductions during earlier waves?
Yeah, I think that the legacy issues in the healthcare system, we call them that, are well known and well documented, and the impact that those legacy issues have had on our healthcare professionals and on Nova Scotians has been pretty traumatic. So I know that our healthcare workers they're giving it their all. They really are, and the situation today is magnified by a number of factors. So first off, we have people who are being admitted to the hospital because of their COVID condition. So we've talked about that numbers in the range of 60 people. It has an impact on the healthcare system. In addition to that, as we've talked about and people have talked about, there's a number of people in the hospital who have also contracted the virus. That has an also pull on resources, because no matter what you're in for, if you contract COVID, there's a different protocol. So that has a draw on resources as well. So that's two significant draws on resources. And the third one is we're short people because we have healthcare professionals who are off as a result of COVID. So that's three moving parts that are having a significant impact on our healthcare system. We're seeing that show up in surgeries and procedures that are postponed. We're seeing that in wait times. So we're seeing that impact, and that impact will. It's real, and it will take some time to overcome that impact. But what I want Nova Scotians to know is that when you need care, you will get care from extremely dedicated and talented healthcare professionals. They are doing everything they can to make sure that they keep Nova Scotians safe, and they have the support of the government in terms of the investments and support that are necessary. So the impact is real. The response and the commitment to responding to it is also very real.
Alicia, do you have a follow-up question?
Yeah, just on the note of staffing shortages, is there any consideration of maybe bringing back some of those employees who left their jobs late last year because of vaccination status?
No. There's lots of system management discussions that are happening in terms of, redeploying certain people within the healthcare system to different areas. You're seeing that, procedures and surgeries canceled or postponed, and then using those resources, redeploying those resources. There is the healthcare system, the human resources of the healthcare system are being very actively managed, but that's not part of that management process.
Next, we'll go to Brian Flynn with All Nova Scotia. Go ahead, Brian.
Hi, Premier. You had said about a month ago that you had some concerns with the sizing of the Halifax infirmary project. You said you had a lot of questions about that project at that time. There was some analysis taking place. Could you tell us more about what analysis is going on and what questions you had?
Listen, thank you, Brian, for asking the question, because the investment in healthcare infrastructure is very necessary. We see that. Anyone who's been in some of our facilities, it's very obvious that there's an investment that's required. And my focus and my concerns and my questions are always around making sure that the investment that we're making today is appropriate, not just for today, but for the future. So I think I'll always have questions and concerns about how taxpayer money is spent, and I'll continue to ask those questions. But to answer your question directly, my focus has always been: are we looking at the needs of Nova Scotians 30, 40, 50 years out, because this is how long these assets are going to be there. We have to realistically. So are we looking at the needs of the future and making decisions today to make sure that those needs are met in an area where technology changes very quickly, and the way that care is delivered changes very quickly. So we have to be on top of these things, and my questions and concerns are always around pushing the team to make sure that we're on top of those things. So those are active discussions that will probably never be concluded. They should always be ongoing. We should always be looking to the future on those things, and I'll continue to do that.
Brian, do you have a follow-up question?
I do, thanks. Premier, we're only a few weeks out from a deadline for the province to make a decision on procurement of the hospital project. I'm wondering, based on those questions that you just talked about, what answers are you getting, and are you comfortable moving ahead with the project at this time?
Yeah, they're ongoing. So they'll always be. We should always be looking at these things. And yes, I have a lot of confidence in the team that's working on these projects, and we'll have ongoing discussions about different aspects of it. So there is an investment that is required in healthcare infrastructure. That is for sure. And we're proceeding down a path that will see significant investments in healthcare infrastructure. But we'll always continue to ask for more, ask for better, ask for more modern. For sure, those things will always happen.
Next, we'll go to Heidi Petrashik with CTV. Go ahead, Heidi.
Thank you very much. I just want to go back, Premier, to the idea of alleviating the pressure on staffing in healthcare. What about the idea of bringing in, like internationally trained healthcare workers such as nurses to alleviate some of that pressure? Is that something you would look at doing?
Absolutely, I've seen that. That's happening in other jurisdictions. We're looking at all kinds of options. We, including students that are still studying through the process. Is there a role for them? Is there expanded roles for existing healthcare professionals? So. I would just say that yes, it's being considered, and we're not ruling out anything. We won't dismiss any possibility of supporting our healthcare professionals through this crisis, but also in the long term. We talked about the legacy issues that were already there. So the staffing pressures have been there for quite some time. So we're looking at short-term solutions, but also short-term solutions that can be effective in the long term, because we want our healthcare professionals to know that this is an ongoing process, but that there is a light at the end of the tunnel. We will be there to support them, and it will involve new ideas, and we're focused on those.
Heidi, do you have a follow-up question?
Yes, there has been some criticism over the province's decision to give numbers in terms of COVID hospitalizations of just numbers of those admitted because of COVID, as opposed to those who develop it in hospital or who have their conditions exacerbated by COVID while in hospital. Some would say perhaps the total number should be given out. Are you looking at changing that strategy then moving forward when it comes to informing the public?
Yeah, I've heard some of the the feedback on that. What I would say is the reporting is evolving. Even yesterday, the release that went out had more, was more detailed and had more information than previous releases. So we're constantly looking at evolving the reporting process. And for purposes of the COVID briefings with Dr. Strang, we're very focused on the direct impact of COVID on individuals and families, and the restrictions and what's the potential of an individual Nova Scotians virus deteriorating to the point where they need hospitalization. That's why we focused on the hospitalization number in those briefings. But as I've said, there are other people in hospital that also have resource requirements and treatment requirements, and that's impacting the system. So we've released those numbers. We'll continue to evolve the reporting, and I've heard the feedback, and we'll respond as much as we can.
We are running short of time, so I would just ask for the remaining reporters, just try to keep your questions as short as possible, if you can. Next, we'll go to Pat Healy with the Laker. Go ahead, Pat.
Hi, Premier Houston. What are your thoughts on Federal Health Minister Jean-Yves Duclos suggesting a mandatory vaccination policy, which would be under the authority of the provincial and territorial governments? Is Nova Scotia considering following this suggestion?
Thank you, Pat, for the question, and I don't know if that was also meant that the Premier should keep his answers shorter in the interest of time, but you're too kind. But listen, this is an ongoing discussion, Pat. Vaccines are effective. Vaccines are safe. Vaccines are the opportunity that we have to keep ourselves and our families and our communities safe. So we encourage people to get vaccinated. In this province, we've had a number of, we have a number of vaccine mandates in place. There's been people in this province that are off work over the vaccine. You can't visit restaurants and events. So we've been pretty serious about vaccines for sure, and we'll continue to be so. We want more people to get vaccinated. We encourage people to get their boosters. We're working really hard to make those available to Nova Scotians. And but in terms of a blanket, a mandatory vaccine, I certainly understand where the federal minister is coming from. In wanting more people to get vaccinated, but that's not a discussion that we're having at the provincial level.
Pat, do you have a follow-up question?
No, I do not. Thank you very much.
Perfect, thank you. We'll go to Jennifer Henderson with the Halifax Examiner next. Go ahead, Jennifer.
Good afternoon, Premier. Can you tell us if the Yarmouth Ferry will operate this summer, and what did it cost last year when it did not operate?
My expectation is that it will operate this summer, and of course, we know that it's the operation hasn't had a kind of full successful season by any really measurement that I can see in the past. But my expectation is that this year we'll have a full season. In terms of the cost, I believe the cost for this year is in the range of $14 million. You've asked specifically about last year. I'll have to get you that number.
Jennifer, do you have a follow-up question?
Yes, thank you for that answer. My other question pertains to an out-of-court settlement with former Justice Department lawyer Alex Cameron. Can you tell the public whether a settlement is in the process of being negotiated with Mr. Cameron, or it has been finalized?
My understanding is that the situation has been resolved, but that's my understanding, is that it has been resolved.
Okay, next we'll go to Paul Bacon with All Nova Scotia. Go ahead, Paul.
Thank you. Premier, do you think MLAs deserve a raise after an 11-year salary freeze?
Well, I mean, certainly when you think about what's happened in our economy and the impacts on Nova Scotians, and we've had lots of discussions about compensation of Nova Scotians' impact on our economy. This was not something that was on my radar of things to kind of focus on.
Paul, do you have a follow-up question?
Yes, but you are required by law, of course, to strike the committee and review the salaries. Would you, are you saying you wouldn't abide by the results of the panel if they recommended a raise?
No, I think the speaker is within the speaker's responsibility, and you mentioned there's legislation to do a review. So the speaker has triggered that process. He'll put a panel of people together to look at that, and they'll do their work. I don't want to presuppose the outcome of their work, or, as I said, in the case of the minimum wage review, undermine work, particularly undermine work that hasn't even been done yet. So this wasn't something that was on my radar, but the speaker has triggered it, and it'll we'll let that committee get struck and do their work and go from there.
And unfortunately, that's all the time we have for today. Thank you, Premier.
Okay, thank you.